Greetings. I am Dr. Robert Mallet, Professor of Integrative Physiology at the University of North Texas Health Science Center in Fort Worth, Texas. Today, March 26, 2013, it is my honor and privilege to interview my good friend and colleague, Dr. H. Fred Downey, for the American Physiological Society's Living History Project. Dr. Downey has been a member of the APS since 1975 and a long-standing member of the APS cardiovascular section. His research has made fundamental contributions to our understanding of the mechanisms controlling coronary blood flow and oxygen supply and demand to the myocardium, as well as mechanisms by which the myocardium is protected from ischemic injury. Dr. Downey retired in 2011 as a Regents Professor of Integrative Physiology at the UNT Health Science Center. And since then, he has continued his affiliation with the university as a salaried adjunct professor. And in his current role, he is continuing his long-standing commitment to medical and graduate education and his collaborative research both within the institution and internationally. Dr. Downey, I would like to ask you some questions about your life and career for the APS Living History Project. Would you please tell us something about your early life and how you became interested in science?
First, thank you, Bob, for conducting this interview, and I thank the American Physiological Society for inviting me to participate in the Living History Project. You asked about my early life. I grew up on a farm in western Maryland and went to a high school that was certainly not a top-tier high school. And I really didn't develop an interest in science. I studied vocational agriculture, but my parents expected me to go to college. And there I chose a major in vocational agriculture instruction, thinking that in the future I would become a high school agriculture teacher. However, I found that college was stimulating and exciting and not as difficult as I had anticipated. In my second year of college, I had courses in vegetable gardening and tractor repair, and I decided that I really didn't want to teach young people those subjects as a high school teacher. Meanwhile, I found that chemistry and botany and zoology were very interesting and not nearly as difficult as I had anticipated. So then I became really interested in science, and I redirected my major to a program that would, in a sense, prepare me for graduate school in agriculture. The university program allowed me to take courses such as college algebra and quantitative analysis, organic chemistry in my junior and senior year so that I would be ready for graduate school.
So after graduating with a bachelor's degree, you decided to continue your education toward a master's degree. Could you please tell us something about your master's research?
The master's program I enrolled in was at the University of Maryland and was also in agriculture. And I was still playing catch-up with my science. For example, in the first year of graduate school, I took calculus for no credit. Of course, I should have taken that years earlier, but I didn't. I took biochemistry and other academic subjects, did reasonably well. I liked those science courses. And then it was time to do research for a master's degree. I began a project dealing with calcium metabolism, and very early in that experience, a professor from the Oak Ridge Atomic Energy Commission laboratory came to our department and gave a seminar on calcium metabolism, describing his use of radioactive isotopes to study calcium metabolism. That was very interesting to me, and to make the story somewhat shorter, after some conversations with this scientist, Dr. Ray Craigle, I was invited to go to Oak Ridge and do my master's research under Dr. Craigle's direction at the Atomic Energy Commission Laboratory. And that was an experience that really opened my eyes to various avenues of research that I had not previously considered, particularly the use of radioactive material in research.
So that prompted you to change your interest from agricultural to biophysics then. That must have been quite a change.
It was indeed a change. I was young and foolish and brave. Dr. Craigle had graduated from the University of Illinois. He spoke very highly of that university. I think he expected me to go there in agriculture, but I had been intrigued with the physical side of biology using the radioactive materials, and I had more or less caught up on my mathematics. So when I learned about a program in biophysics that was also associated with the Department of Physiology at the University of Illinois, I applied to that program. And somewhat to my surprise, I was accepted into that biophysics program. And after completing my master's degree, I enrolled in the biophysics program. They were generous. They provided me a full fellowship, which I thought was a good deal because then I could take 16 or 18 credits of courses and rather than doing a teaching fellowship. Thinking back, I worked very hard, and I was still playing catch-up on physics and mathematics. I believe I was a token biologist in this program. My other graduate student colleagues were physicists, many from the campus from Illinois, which is a very famous physics school, and probably they had decided they weren't going to win a Nobel Prize in physics, and they transferred to biophysics and did very well. I enjoyed that program, but it was challenging for me. I also had to take 2 foreign languages, at least display reading knowledge of 2 foreign languages. I chose among French, German, and Russian, the 2 easier ones, French and German. And after wearing out a German dictionary and much stress, I finally passed those requirements which were necessary for the PhD. I think such requirements have gone by the wayside now, but I certainly invested a lot of effort in meeting those requirements.
What career options did you consider after you completed your PhD at the University of Illinois?
As I approached graduation in 1968, there were numerous options available. It was a time when science was expanding in the United States, and I used to enjoy looking at the bulletin board for all the positions open for assistant professors, as well as postdoctoral appointments. By the time I graduated, I had a young family, and I was anxious to get on the other side of the classroom. Again, I was perhaps young and foolish. I was offered several very excellent postdoctoral appointments with scientists that continue to be very well known and successful. Looking back on it, I probably should have accepted one of those postdoctoral appointments, but I wanted to be a professor. I was offered several appointments, but the one that I took was there at the University of Illinois. I was appointed as an assistant professor of veterinary physiology with a joint appointment in the Department of Physiology from where I graduated. It seemed like the best of all worlds. My My PhD advisor was there on campus. We planned to continue our work together, and it was at that time a good decision.
Tell us about your experience at the Veterinary College at the University of Illinois.
I learned to teach physiology there because my primary job for the first semester of each year was to teach about 70 veterinary students physiology. I gave the lectures and I supervised a laboratory for all of those students in two sections, half on Tuesday and half on Thursday, with the help of one graduate student. In those days, we used many laboratory animals, primarily dogs. The veterinary students were taught to anesthetize these animals as part of the laboratory. You can imagine that sometimes that was a stressful experience for all concerned. But we did that, and I learned a lot of basic physiology that's necessary for teaching in many subjects. Everything, I think, except central nervous system I taught, and gastrointestinal physiology I taught there. And it was certainly a continuing education process. I began a research project. It was funded by the Department of Agriculture to study blood flow to the mammary gland of goats. So I was a goat herder for a while, and a goat milker, and we did surgery on the goats and planted electromagnetic flow meters on the mammary artery and studied factors that regulated the mammary blood flow. However, my interest in coronary physiology was not so important to the veterinary college, and I wanted to continue coronary research, and I began to look around for a medical school where I would be more likely to be supported and my coronary research would be more appreciated.
What brought you to Southwestern Medical School in Dallas?
To my surprise, out of the blue came a telephone call from Dr. Fuad Bashir, a professor of medicine at Southwestern Medical School, who had learned of me from one of his colleagues, Dr. Francis Hattie at Michigan State University. I had contacted Dr. Hattie about a possible job at Michigan State. And Dr. Hattie sent my credentials to Dr. Bashir in Dallas. Dr. Bashir was looking for a research director for his laboratory. Dr. Bashir had at that time a large training program to teach cardiology fellows. The cardiology fellows needed a research experience. The laboratory was well equipped, it was staffed, and it needed someone to know what to do with it. By that time in my career, I had a lot of ideas of coronary research projects. I was very lucky to find an opportunity where I had a laboratory, some assistants, some cardiology fellows who wanted to do research, adequate funding internally, and it was a great opportunity for me. It also gave me an appointment in medical physiology at the Southwestern Medical School, where I did teach in the laboratories and gave a few lectures. So I felt they're a real part of the medical school.
What were your teaching and research responsibilities at Southwestern Medical School?
The primary responsibilities were 2 afternoons a week during one semester to supervise a laboratory section, again where we did many experiments with laboratory animals. And these medical students were very anxious to learn, participate in these experiments. And in doing so, I also worked with the other faculty, the young faculty as well as senior faculty all came to these teaching laboratories, and it was a good chance to learn to know and interact with my colleagues there at Southwestern. I gave a few lectures in cardiovascular physiology, and I had an opportunity to supervise a seminar program. The seminar program was well funded, and we were able to invite outstanding famous people to come, and I had the honor to be their host for most cases. And for example, Robert Byrne and Arthur Guyton, Howard Morgan, Matthew Levy, many of the big name physiologists in the 70s and early 80s came to Southwestern as part of that seminar program, and I had nice opportunities to learn to know them and interact with them. It was a real honor and pleasure for me.
So after 12 years at Southwestern, you accepted an appointment at what was then the Texas College of Osteopathic Medicine in Fort Worth. What led you to that move?
At that time, the training program in cardiology of Dr. Bashur was waning, and while he continued his interest in research, I thought that my opportunities there might decrease. At the same time, this university, at that time Texas College of Osteopathic Medicine, was expanding. It was transitioning from a rather small, dedicated teaching medical school to a basic science, health science center. The Department of Physiology had recently hired a coronary physiologist, Carl Jones, who came from Texas A&M and whose work I was familiar with, and I respected his research in coronary circulation. And his invitation to come here was an offer that I'm glad I didn't refuse. It gave me a promotion from associate to full professor in a department that was growing, that emphasized cardiovascular research, had all the facilities that I needed for my research, and it was a place to continue my work. At that time, I had two significant grants, one a 5-year R01 grant, and this college was very happy to have that money transfer from Dallas to Fort Worth.
Now, here in Fort Worth, your research expanded to areas beyond coronary physiology. Could you comment on those other research areas?
For the first 15 years or so, the laboratory did and continued to emphasize coronary circulation, and we were, I think, reasonably successful in some of those projects. One of the projects involved comparing the physiology of flow regulation in left and right coronary circulations. And as you know, most coronary physiologists have studied the left coronary circulation, rightfully so, I think, because that's the part of the heart that most often experiences myocardial infarction. But we did find that there's some interesting differences in flow regulation between the left and right coronary circulation. And with the help of a number of postdoctors and colleagues here at the school, James Caffrey and John Goggle, I think we did some interesting, exciting work with comparing differences with left and right coronary physiology, and there really are some I think very important physiological differences. Then research expanded to methods of cardioprotection. The interest in ischemic preconditioning was expanding greatly at that time. My former graduate student colleague, James Downey, was very active in preconditioning research, as you know. As an aside, let me say that when I was a student with Edward Kirk, my fellow student was James Downey, Jim Downey. We don't know of any common relatives, but we trained together in the same laboratory and went on to study cardiovascular research, and has been extremely successful in his career. Edward Kirk once said, give me enough Downeys and I'll solve all the problems of heart research, but I think he would have needed zillions, and there weren't that many. As I was saying, preconditioning was a developing field. We did some studies with hypoxic preconditioning, where we exposed the coronary circulation selectively to hypoxia and found that it had a preconditioning effect. It prevented or reduced the ischemic damage to coronary obstruction. This led us to consider whether whole body hypoxic conditioning might have some beneficial effect to the heart. In fact, I had attended a meeting on hypoxic training, primarily for athletic purposes, in Russia, where one physician talked about having his patients breathe a hypoxic atmosphere, and that this reduced their angina attacks. This seemed like heresy to me. Everybody knows the coronary circulation delivers oxygen to the heart, and the more oxygen, the better. And how could it be that having a patient with coronary disease breathe a low oxygen atmosphere, how could that be beneficial? I came back to Fort Worth, and we decided to test this. And we could test it not with patients with angina, but we would expose animals to a hypoxic atmosphere and then study coronary ischemic reperfusion damage, just as we did in the classic preconditioning model, and see if there was an effect. Well, to my surprise, this whole body hypoxic conditioning had a dramatic effect in reducing myocardial ischemic reperfusion injury. And it was surprising, it was controversial, remains controversial, as you know, and yet it seemed to be a very effective mechanism for limiting myocardial damage. That was one of the expansions of our research, and we've continued to do some of that research in collaboration with you and Dr. Caffrey. This being an osteopathic teaching school, there's always been an interest in the function of the lymphatic system, because osteopathic physicians perform maneuvers that are called lymphatic pump treatments, and they are used in a number of conditions to treat infection, to improve drainage from the interstitial space, to lessen edema. It occurred to me that one might study that. My PhD research had involved studies of lymph from the heart. So we say that the old folks go back to their roots in research, and I guess that's true, because I got interested in the lymphatic function and how it might change with osteopathic manipulation. The story, interesting story, is that a osteopathic student was in my lab as a student assistant during the summer about 10 years ago, and he needed a project to work on that summer. We were instrumenting hearts with electromagnetic flow meters in order to study coronary blood flow. And I said to the student, perhaps you could put a flow transducer on this thoracic lymph duct, which was readily exposed there in the chest. And if you could measure lymph flow, maybe we could make a project for you out of that. Well, the student thought that was a good idea. He needed a project. It sounded osteopathic. So we implanted the flow transducer, and 10 days later, when the research subject had recovered and was wagging its tail, we attached the flow transducer to the electronics, and sure enough, we could record flow in the thoracic lymph duct. We noticed that when the animal moved, the flow transducer gave a changing signal. So that afternoon, we called the chair of the manipulative medicine department, and Dr. Stahl came immediately over. We didn't have to make an appointment for 3 months in advance. He came immediately over to the laboratory, laid hands upon the dog in the appropriate osteopathic manner, made rhythmic compressions of the chest and also later on the abdominal, and the flow went up 2 to 3-fold. Dr. Stahl was the happiest guy on campus that day because this was the first time that any osteopathic-like procedure had been clearly demonstrated to increase lymph flow. Dr. Knott, or student Knott, became interested in this. He continued the project, published a nice paper about this, and won a nice award from the American Osteopathic Association. And yes, we've continued this research. As you know, we learned to not only implant flow meters, but we learned to catheterize the thoracic lymph duct and exteriorize the catheter so we could collect lymph, and then studied the effect of osteopathic manipulation on the contents of the lymph. The osteopathic physicians have long maintained that the lymphatic pump techniques enhance immunity and could be used as adjunct therapy for patients with infections. Well, it seemed obvious we should count the leukocytes in the lymph. At that time, a young assistant professor, Dr. Lisa Hodge, was available and volunteered to do the leukocyte counts from our samples. Lo and behold, the leukocyte counts about doubled during the manipulation. Well, this is really exciting for osteopathic philosophy and exciting to us because that finding we really didn't expect. We thought the manipulation would change the flow, but we didn't know about the lymph count. So as these studies progressed, Dr. Hodge recognized that this was a model to study leukocyte trafficking. Where did these leukocytes come from? What did they do after they were mobilized with the osteopathic manipulation? And she took over that part of the project. Dr. Hodge was funded with a 5-year R01 NIH grant to study leukocyte trafficking as affected by osteopathic manipulation. And then instead of she working for me, I began to work for her. And we've continued a very fruitful collaboration up until the present time. At the moment, we have a paper in press dealing with this subject. And so Dr. Hodge has been quite successful and a good colleague in this project.
You have attended many APS meetings. Would you like to comment on your experiences and impressions at those meetings?
I've certainly attended a large number of such meetings. I'm not sure when the first meeting was. I went to my first Federation meeting in 1964 or 5, where I gave a talk on my master's research. And then a few years later, I began to go to the APS meetings as my research in coronary circulation developed. I remember at one of those meetings, Dr. Eric Feigl vigorously questioning a presenter in a polite way, but it was rather obvious that Dr. Feigl knew more about the subject than the presenter. And I recognized that if I was going to be a successful presenter at such meetings, I better know my stuff, because there would be people like that in the audience, and I certainly didn't want to display any ignorance. The meetings were collegial, though. They were smaller than they are now. At least the coronary were small enough that people really knew each other. And they were oral sessions rather than the posters we have now. So you really got to hear people present and observe the questioning, and some of the controversies that came out in those meetings were interesting. And it was an opportunity to learn to know people that were active in the field, and I did enjoy attending those meetings. The Physiology Society in those days had a fall meeting that was on college campuses, and I remember with pleasure taking my family to various campuses and staying in the dormitories and attending relatively small meetings where we got to know the people who were attending. The difference, what we see now, there's a zillion posters, and they're certainly not always very well attended. And I think the meetings have become so big that it's hard to interact. On the other hand, the APS now is having specialty meetings, which bring together, separate from the experimental biology meetings, people who are interested in specific physiological topics, and I think that's a very good thing.
How has your association with APS impacted your career?
Became a member in I think, 75. It's interesting. I made the application, and I really sweated whether I'd be accepted. It was a big deal for me to become a member of the society. I suspect now maybe it wasn't so difficult to become a member, and certainly I think now it's maybe less difficult. But in those days it was considered among my colleagues a big deal, and I was extremely pleased to be accepted into this organization. And I've enjoyed attending the meetings, both these smaller fall meetings and the big experimental biology or Federation meeting, as it was called back then. I certainly recognize the importance of the journals published by the society and their value to the physiological profession. It was a real pleasure to publish my first paper from my dissertation in AJP in 1968, and I was very proud of that. And over the years, we published a number of papers in the American Physiological Journal, and those journals maintain a high standard, and I think it's something that I hope will be maintained. There's certainly a expansion of scientific journals, and I hope that this expansion and universal access doesn't dilute the standards of the American Physiological Society journals. And finally, being a member of the society has helped me meet colleagues and learn to know people who were important in the research areas that I was interested in, and it's provided fellowship and friendship and stimulation for my research. So I'm pleased to be a member, and I would like to continue to be a member for a while.
What changes have you observed during your career in graduate education?
Some things have changed, and some things perhaps stay the same. It's really hard to pick out differences. I think certainly the international character of the student body has changed. When I was a student, there were very few international students. As you know now, there are many foreign students, and they bring important diversity to the program. Many of them stay on and have become outstanding scientists in the United States. So I think that's a pool of talent that we recognize, and I think the federal government should do whatever it can to make it easier for these scientists to gain American citizenship. On the other hand, with the difficulty or poor prospects of funding for our current graduates and maybe future graduates, I see fewer students who are really committed to become scientists. More of them, perhaps wisely, are hedging their bets and going to medical school or preparing for some other career, such as regulatory agencies or undergraduate college teaching. And that's fine, but at least at our school here, I miss the students who really wanted to be professors at medical schools. My own graduate students, most of them over the years have gone on to become physicians, and I'm sure they're excellent physicians. But I can mention one who has stayed with science, has done extremely well, Dr. John Toon, who you know, who is now at Indiana Medical School as a professor, and will receive an outstanding award for young scientists at the upcoming American Physiological Society. So John is one of those guys that from the beginning, as soon as he started research, he loved it, he was good at it, he knew he wanted to do that for his career, and he's been successful. It's that kind of student that we should recruit and see them prosper.
In addition to APS, you've been active in other scientific organizations. Would you comment on some of those activities?
In the earlier days, I was active in the Microcircuitry Society and also in the International Society for Oxygen Transport to Tissue. That society has meetings all over the world, and it's led to some exciting travel experiences. I guess the other society I would mention is a Society for Experimental Biology and Medicine, and I've enjoyed being a member of that, and have been honored to have some leadership responsibilities as counselor and as treasurer of the society. And also recently they gave me an award as a distinguished scientist, which I value very much. This society is multidisciplinary, as you know. It attracts members from clinical science as well as basic science, and it's provided an opportunity for me to learn to know people outside of my field, and I've met some outstanding scientists in my association with this society.
Now, you personally did not take a postdoctoral position. Was that a good decision, and would you make that same decision now?
I'm sure my career trajectory would have been different if I had taken the postdoctoral one of the postdoctoral positions I was offered. Would I have ended up at the same place, at the same level? Probably. But maybe I would have risen faster had I taken the postdoctoral position. On the other hand, in those days, as opposed to now, it was quite possible to go from a graduate school PhD to an assistant professorship. And as I said earlier, with a young family, I was anxious to get on with my career. Looking back on it, the postdoctoral experience would have taught me a lot. It would have helped my research accelerate faster. There's no doubt of that. At the present time, doctoral graduates who want to become academic faculty must take a postdoctoral position. I caution them not to let the postdoctoral experience last too long, though, and they must find have a fruitful experience, a productive experience. Publish. Begin to write grants or secure early grant support, and then they're in an excellent position for an academic appointment.
You've had a number of postdoctoral trainees and graduate students. Would you tell me about some of those?
Yes, my research prospered greatly by the opportunity to have a number of outstanding postdoctoral fellows. In Dallas, George Crystal came from Rutgers University to be a postdoctoral fellow, and he was, he was a very successful, ambitious, talented scientist. And after a couple years, he was appointed assistant professor there at Southwestern, continued to work with me, and later transitioned to the University of Illinois Medical School in Chicago, where he continues today as a professor, and he's had a very successful career there. When I came to Fort Worth, I had opportunities to recruit a series of Japanese physicians. They were cardiology fellows from Sapporo Medical School. These were young Japanese physicians who were getting a PhD degree from their institution with the research component for their doctorate conducted in my lab. They were smart, ambitious, friendly, and we got a lot of work done. I had 7, I think, Japanese postdoctors, and I maintained some contact with some of them, and they've become very fine cardiologists and have had successful careers. In more recent times, Dr. Bian and Dr. Zhang, Dr. Bai were postdoctors from mainland China, and they also were very active and productive in the research laboratory. Dr. Bian is a remarkable fellow, a surgeon from China who had very interesting ideas about new devices. He is an inventor, and he came up with many interesting ideas for medical devices. 5 of those ideas became U.S. patents, with Downey and Bien as the patent holder. You could ask what happened to those patents. These patents were licensed by our university to an entrepreneur, but this person, his company, has, for reasons unknown to me, never developed or exploited those patents. We did get small money to do the research to demonstrate feasibility of the devices. And in the process, we got a few publications after the patents were granted describing these devices and what they might do. It's a disappointment to me and to Dr. Bien that none of these discoveries have been commercialized. I still believe that there's potential there, but for whatever reasons, the holder of the license hasn't developed them. Dr. Zhang did the basic research on cardioprotection with whole body hypoxia conditioning, and I recognize his contributions to those studies.
Fred, what changes in academic research have you observed during your career?
Research at universities has certainly become more of a business and more of a team effort. In the earlier times, a professor with a laboratory and some students could go and do science productively, noteworthy science, I think. But now it takes an army, it seems, of people with various expertise in order to garner funding and to complete a complex research project. I've seen also the universities become more and more dependent on the grant money, and for the grant money to pay the faculty from their direct cost, and I worry about that. I've seen the universities become more and more dependent on the indirect cost that they garner from our grants. And as there is ever a cutback on federal funding of research, how the university superstructure can be weaned from this dependence on indirect cost support, I'm not sure. The other thing that has changed greatly is the regulatory environment that academic researchers must contend with. In the earlier days, one could have a bright idea today and either this afternoon or tomorrow go and do an experiment to test the idea or to explore it. If such an idea involved animal research, it would take months here to gain approval from the Institutional Animal Care and Use Committee to do even the simplest of animal procedures. And some of my colleagues tell me that we're well off, that at other universities it may take 6 to 8 months to gain permission to do that. And certainly there are other areas of research that are increasingly regulated. Certainly the areas of safety are important and need to be regulated. But sometimes all the regulatory burden becomes overwhelming. And one of the reasons that I'm sleeping better in my semi-retirement is that I don't have to contend with these hurdles or barriers to research. And I worry about American science in this regard, that we are strapping ourselves with such overwhelming regulation that we'll lose our ability to compete in the world of ideas. And from my travels, I can tell you that the Chinese and the Russians and the Indians don't have near these impediments to their research. We can argue whether they should have more or not, but science can progress faster in a less regulated role. And I've never thought that scientists were evil and yet the regulatory hurdles that we deal with, that you deal with now, almost say that we're guilty until proven innocent, and yet the instances of abuse that I'm aware of are almost non-existent, and yet we have this great superstructure to make sure that there's no abuse and no unsafe practices and no other problems. So I worry about that. That's certainly a change that I've observed.
Fred, I have one more question. What is the most important advice that you would give to a new physiology faculty member to help that person advance in his or her career?
Well, Bob, the easy answer is to work hard and do well. To expand on that, the young faculty members should not avoid teaching, but they should be sure that their teaching is limited to areas that they are certainly competent in, and that the time commitment to their teaching is not excessive. But they shouldn't avoid teaching. Teaching has been important, I think, in my career. Second, they must develop a research program that will grow out of their postdoctoral experience. And they must commit the time and effort to make that research program successful. That may mean working Saturdays and Sundays and late at night. It probably will mean sacrificing some quality time with the family. But certainly in today's environment, that kind of complete commitment to the research effort is necessary. Young faculty members should avoid distractions, campus politics, good causes, too much visiting with friends, whatever. Avoid the distractions and tend to the research, because if you're not successful with the research, most likely your job won't continue very long and your career will be short. Another thing with the research, one should really concentrate on one area. In my case, I've probably over the years dallied in too many different things. I could always read a paper and say, gee, there's something I could study. And then when I had money, I could go study it, and that would distract me maybe from the main emphasis of my research program. So I would advise the young scientists to stake out their claim and work on that project. And even though some of it seems repetitive to them or confirmatory, to work at it to the extent that they become known in their field as an expert on that scientific area. That will pay big dividends in the future. As the research develops, it's important for the young scientists to grow in their field, in the techniques that they use, in their understanding of where the field in general is progressing. Now, to do that, one has to not only read the current literature, one has to keep in contact with their colleagues, doing this at meetings and visiting universities as they travel. But I think the opportunity for extended periods of time in another academic laboratory is an important thing. I'm talking about sabbatical experience here. That's one of the things that our school has not provided for our faculty up to this time. And I think it's an important way for a young faculty member to keep current or advance into new areas of research closely related to what they've been doing, and thus grow and expand their research work. And if they do that, their career will prosper.
Fred, thank you so much for your time and for sharing your experiences and your wisdom with the American Physiological Society.
Well, it's my pleasure to participate in this project. Thank you.